I trained a candidate who's having an interview on coming Friday, and her interview is only 10 minutes. So that's a big struggle against time. So what I trained her is that how do you prove yourself to totally a stranger panel of professionals that you are the right candidate within 10 minutes. Instantly, a rejection would be someone who does not show the right attitude towards work. So if a doctor fails to demonstrate that they are not safe, they are not willing to take feedback, and they are having overconfidence and they are egoistic, all these attitude related things would immediately reject a candidate. Because qualifications, anyone can gain qualifications, because by the time they come into an interview panel, when we interview 3-4 candidates for a single role, almost everybody looks identical on the paper on qualifications. Almost everybody has a basic degree, they have done AMC exams, and they have a couple of years of clinical experience. So for me, as an interviewer, everybody is looking identical on the paper and on the CV from qualification side. So what makes you a unique person from the other 4 or other 5 candidates is your personal characteristics of who you are, how confident and competent you are, and how willing you are to work in a collaborative environment. Recently, we had an interview for an ED registrar role, and I sat in the ED interview panel. And there were multiple candidates, but one doctor who was passionate in that job and who wanted to do multiple projects in that area, and who talked passionately about the work ethics and how she would treat the patients, she would handle the difficult situations. She immediately stood out against other candidates. So just after the interview, all the interview panel members were just in unison, in agreement that she is the preferred candidate. So it's who you are and how you showcase yourself. It's not just showing off or just pretending that you are going to be the right person. Because we can instantly feel that if someone is trying to reading through a script or trying to pretend someone whom they are not, we immediately get that. So be yourself and come with the right attitude. So because a lot of doctors think that we don't analyze those things in the interviews, because simply we are asking technical questions. Most of the time, yes, the questions might sound technical, but there are a lot of other aspects we evaluate through those questions. Although they are not direct questions asking what personality you are and how good you are as a team member, we wouldn't ask those questions directly, but all the questions we ask you would give us an idea about who you are and what type of a doctor you are going to be in our team. CV is utmost priority, because CV is the first impression you are going to create in the receiving end's mind, because we don't see the candidate, we don't speak to the candidate on the first place. What we see is your CV. So the CV should represent your skills, core competencies, and your clinical experiences on top of qualifications. Nicely streamlined, meticulously drafted CV is very, very important, because it's like your mirror image, because you don't have the chance to speak, you don't interact with the team. So it's just this paper representing you. The selection process can be multi-layered. So first one is a system, so IT based screening, because simply human, we don't have enough staffing to go through all the CVs, read it one by one. So the initial first layer would be a technical IT based screening. So that's where the technical side of the CV comes in handy. So it has to be in a right format without too much distractions, graphical distractions, font changes, structural changes. So that's where the CV has to be in the right format and very simplified to go through that technical screening. So after that technical screening, then it goes to the HR department. So then there would be a human, but a non-medical person going through the CVs and making sure that the first screening is right, and looking at the qualifications and experiences. and that's the second layer of selection. And then at the end of that screening, then it comes to the directors, the hospital department directors. So then the department director would look at the shortlisted interview applications, and then he or she would say, okay, I'm going to interview this person. MedStart program is one of my passion projects actually. So as I told you, when I started, I didn't know much about Australian healthcare system. So I was same as any other doctor who's coming to Australia. So without much preparation, we are like so excited and overwhelmed by the fact that we found a job and we just pack our bag and come and work. So when you are in the real working environment, only you understand how complex this is and how different this is from where we have studied and worked. So I struggled a lot because we didn't have a right orientation program to take us through everything we need to know as newly starting doctors. It's true, there are like most of the hospitals offer their own orientation programs when they onboard new doctors, but those orientation programs are designed to fulfill the objectives of the hospital, not the doctor's side. So although you have completed those orientation programs offered by the hospitals, at the end of the orientation program, you are still confused. You still have the same questions you had when you started the program. My recommendation is any doctor who wants to come to Australia, no matter what your stage is, you may be still getting ready for AMC, or you may have completed AMC, you may be still looking for jobs, or maybe you have a job offer already processing paperwork, or you have maybe started working within last couple of months. Still, if you are a new doctor within first 12 months in the system, I recommend going through this program.
Doctor is also available on GooCampusWorld.com. If you're looking for a session with Doctor, do reach out to us. We will request Doctor to open a slot for you, after which you can book, you can have your session.